guess the first time I really thought there was something really wrong was he had turned 16 and we were driving home, and we were driving around this lake and only about 10 blocks from the house, and he suddenly kind of went to one side of the road and the other side of the road, and I said, "What are you doing, son?" He said, "Well, I'm turning around, we're going the wrong way." So I kept pressing him, I finally made him pull over. That's when he realized, "Dad, I had one of my attacks." And so we knew then, he had to go back to the doctor.
It sounded like he may have been experiencing some confusional episodes related to seizures. We had an opening available that day to do an EEG, which we did here in the office, and he fortunately had a seizure during the EEG.
I was out in the waiting room and they invited me back in there, and I could tell that they were acting very strangely and very like something was wrong or something, and I anyway went in there and he was out and just curled over on his side, and they apparently his seizure went on and on and on for quite a while. We sat down with Hunter while he was waking up from this, and Dr. Barr explained what was happening and stuff, and said he thought Hunter needed to be admitted to the hospital and go ahead and get him on medication right away, because he could show us right on the machine that Hunter had the seizure right there. It was just very opportune.
We performed an MRI of the brain, which showed a lesion in his right temporal lobe. Initially, we started him on medication. We tried the medications and one after another, and the seizures got worse. Hunter was saying, "Let's just get this thing taken out." And I was very apprehensive about it, to tell you the truth. And so they set up an appointment with the surgeon.
It was not clear that this lesion was in fact a tumor. So the workup then continued with Dr. Barr in terms of trying to localize his epilepsy.
They chose to go ahead and be more cautious than just waiting 3 more months, and put him in the monitoring unit to be observed closely. Sure enough, they got the information they needed. He was having too many seizures to be able to comfortably wait 3 more months. July 31st, Hunter had his surgery done.
During the surgery, we were very apprehensive. So when the surgery was over, he came out and told us that it was cancer, basically, and that they felt confident they had gotten it all.
Thank God. It's just been a smooth recovery, and it couldn't have gone any smoother.
It was like before a week or 2 that I was just perfectly right back to normal. It was really fast, and I just kept doing the normal things I would do. Just, running around, swimming, canoeing, going out on the boat and stuff.
I've always imagined that me and Hunter could be really good friends, especially when we're both older and adults, and so I'm just really glad that he's still here so we can have the opportunity.
It's like it's a miracle. We're just so grateful to Florida Hospital and to Dr. Barr and to the surgeon for the job that they did on Hunter.